Could you explain to the people watching this video now what the latest research is telling us about the effects of maternal mental illness and adversity on both fetal and early childhood development, as well as the potential effects that we are starting to see across multiple generations because of this?
Yes, so this is a really extraordinary area of development in our knowledge through research that's been happening, I suppose, over the last 20 years or so, but has really accelerated enormously lately. This research started with us actually who were working in the field being somewhat incredulous at the effects that were being discovered. And these effects were actually now we would say not surprising, but at the time they seemed too big to be believable and too wide-reaching. And what was being discovered was that the state of mind of the mother, not just her physical health, but her mental health, had a direct impact on the well-being of the fetus and of the developing baby, and had long-term effects on the development of the baby. And in a way, that's kind of obvious, because where do we learn about the world we are going to be living in throughout our lives? How do we learn about that? How do we learn how to interact with that world? How do we learn how to survive in that world? How do we learn where the dangers are? Well, all of that comes through our childhood. And of course, evolution has ensured that we learn very quickly and very soon. So our very early childhood is really critical. And we learn that through the people who are closest to us. It's through the interactions that we have. So it's our primary caregivers, and in most societies across the world, that is mainly mothers. It is from them that we learn what is dangerous in the world, what we need to get anxious about, what is frightening and what is worrying. And so it is that nurturing that we get as infants, and the responses that our primary caregiver has to the outside world that teaches us what is safe and what is dangerous. And if our primary caregiver, our mother, is anxious because of terrible circumstances going on around, we will adapt to that. We will become very over-wary, oversensitive to small cues, to any signals of danger. And that is, in a way, completely logical. That is an adaptation to a dangerous world. And what we've discovered, what seemed so amazing, was that this doesn't start at birth. This starts during pregnancy, so that if a mum is anxious, either for a very clear reason, like she's suffering domestic violence, which is very common in pregnancy, that anxiety is transmitted partly, at least hormonally, we know that, but there may be other ways in which this anxiety is transmitted to the fetus, and the fetus emerges prepared for a dangerous world. Truly amazing. But the difficulty very often is that the world isn't that dangerous. This modern world doesn't need us to be jumpy and wary and distractible and untrusting of our relationships. And so that can be quite dysfunctional in our modern human world. And actually, we psychiatrists, when things get quite extreme, can bring our labels, our psychiatric labels to those problems, and label people with anxiety disorder, with deficits in attention, with depression. And so this is exactly what happens. This is what the research showed, that if you're exposed to stress in your primary caregiver, in your mother, stress meaning anxiety or depression, you develop these tendencies. Not inevitably, really important. Most children don't develop these, and not, even more important, not irreversibly. So, for example, exposure to mother's anxiety in pregnancy as a fetus, the effects that have completely disappear, research has shown, if a stable, nurturing relationship develops between mother and baby postnatally. That's one demonstration, but we also know that later in childhood, although it gets more and more difficult to reverse changes, the later you leave it, we know that nurturing care and good relationships, however late it is, actually into adulthood as well, can help us to reduce or eliminate these effects.